Hi, I'm Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. Since 1994, we've been helping older adults in the Phoenix community age gracefully and safely in the place they call home. Since 2014, I've been bringing you Health Futures, Taking Stock in You, a show dedicated to helping you live a longer, healthier, and happier life. Be sure to subscribe, rate, and review this podcast and enjoy the show.
Welcome back to Health Futures, and today I'm very fortunate to have a repeat guest on the studio, or in the studio with me. I've got Nat Findlay. Nat Findlay is the founder and CEO of Lifeguard. Nat, you were here July 25th, 2025, and here you are almost exactly a year later, and you built this company, Lifeguard, to really help older adults age safely at home. And you've got a really interesting background. And, for those that did not see our podcast or view our podcast before, and we were actually in the studio doing radio and podcasting.
That's right.
Today, we're just doing podcasting.
Okay.
And I really would love for you to take us through your journey. So those that are listening in today that don't know Nat Findlay and don't know Lifeguard, I know there was a company called Wellbox, but there was stuff before that too. So I want to set the table for our listeners and our viewers today.
Yeah, there was stuff before that, definitely. So Bob, thank you again for having me in as a repeat guest. Very, very kind of you, generous of you. And again, thank you for the wonderful meeting today at your offices. Yes, so just brief story. A CPA, lawyer, started building fitness equipment, rowing machines, never practiced law. Practiced CPA for a while, but got into
I knew about rowing machines.
Oh yeah, rowing machines and treadmills and stair climbers have patents on all those things.
Wow.
And built a couple of large companies there. Had one washout, one failure, but I guess that was one bad at bat. But long story short, one day an engineer. This is a bit of a long story, but it's all relevant to today's story. Is that a young engineer who was on an internship in the late '90s said, "Hey, we should." He's actually a NASA engineer now, rocket scientist. Yeah, he works for NASA.
Yeah.
And
pretty smart guy.
He was. And he said, we should connect these fitness machines to the internet. And I said, whoa, that sounds very, very cool. Like, how would we do that? So anyway, long story short, we started actually manufacturing our own iPads. This is 1999, 2000, touchscreen computers, multimedia interface. You could surf the internet. You could send emails. You could watch movies.
Wow.
And we attach these screens, think of Peloton, but we attach these screens to 15,000 pieces of fitness equipment in gyms across North America, Gold's Gym, et cetera, et cetera. And in one of the gyms that we were in Dallas, this lovely pharmacist, doctor, emailed our office and said, hey, I've got this great idea for you guys. And so I flew in to see this doctor, pharmacist, who basically he was the chief operating officer of the Dallas Medical City. And he said, I have a medication problem with nurses giving the wrong medication to the wrong patients at the wrong time. Could you put your screens beside the hospital beds? And could you barcode the medication so that we know that the right patient got the right medication at the right time? And so, foolish young entrepreneur, I said, yeah, we can do that. So he allowed us to prototype in his hospital, fortunately, and we got on the radar of a company called Cardinal Health. And a year later, Cardinal Health bought the business, and I stayed at Cardinal for 6 years.
Wow.
Deployed those screens.
This is all new for me, by the way. I knew you worked with Cardinal Health or worked for them, but I didn't realize how you got in.
Yeah, so that was the in. So, along the way, of course, there's the whole .com thing. We'd raised a lot of VC money, and that's a whole other story. So, so my wife and I, after 6 years of that, said that's a lot of corporate Fortune 500 life. Like, it's a big company. You kind of try to make the elephant dance and innovate, but we said, well, let's build electronic medical records. Let's revolutionize primary care. And we'd been to Canyon Ranch, Canyon Ranch in Tucson.
Oh, yeah, down in Tucson.
And I couldn't believe they didn't have an electronic medical record. Nobody had an electronic medical record in those days. And but fortunately, timing, there was the housing crisis and a thing called the TARP funding that would bring the economy back to life.
I remember that, yeah.
Yeah. And so there's $40 billion of funding in what was called the HITECH Act, the Health Information Technology Act, that would allow doctors to transition from paper records to digital records. And fortunately, we had built the world's first cloud-based system. So we opened up 2 little doctor offices in New York City, one in the West Village and one in Brooklyn. And subscription model, a little bit like One Medical. I'm sure you've heard about One Medical.
Oh, yeah.
So we were way ahead of our time. So the doctors in our practice could do telemedicine. They could text patients. They could prescribe online. Everything was, there was no paper.
Is this 09, 08?
This is 09, 08, yeah, 10. Fortunately, the Blue Cross invested heavily in that business, and we moved forward. We didn't proceed with the medical offices. We found managing doctors to be not in our wheelhouse, and so we just concentrated on the electronic medical records. But we built that into a significant business and deployed that software around the world, actually in Australia, Mexico, obviously all through the U.S. And so that kind of leads us to 2015, where we always thought someday the government would pay, large insurance company would pay for telemedicine. And lo and behold, Medicare came out with the fee schedule that indicated that doctors could charge for non-physical visits. And they could do it over the phone or video. And Medicare would pay for this. And holy cow, this is a watershed moment in healthcare. But most importantly, they had an instant 2 rule in the fee schedule that said, oh, by the way, Dr. Jones, if you can't do this, and you don't have time to do it with your 1,000 Medicare patients, you can hire somebody to do it. So that was Wellbox. So we were the service arm of hundreds and hundreds of doctors who said, you know what, yes, help me. My patients need this type of service. I'd like to have the data. And we grew that to about 30,000 patients, 300 nurses, all on a telemedicine platform that we built. And so here we are today. That business was sold. And along the way, I realized that these seniors, that the Medicare patients that we were interacting with, as one lady said, Nurse Jones, I'm 75, I'm 78. I'll always have diabetes, unfortunately. But could you help me with these other things in my life? And unfortunately, our poor nurses would have to say, I'm sorry, I've just got to stick to the Medicare script, which is diabetes today. I said, wow, there's a great opportunity here because we were measuring, the company is called Wellbox, so the patients would receive a little box, so a blood pressure cuff and glucometer, and et cetera.
Thank you for taking us through that. I wanted our listeners and viewers to understand what Wellbox was. So.
Yeah, so in the Wellbox was the things you would need to monitor these patients, remote patient monitoring. Yeah. But boy, they were reluctant participants, and getting seniors to get on a scale 15 times a month or take their blood pressure 15 times. Now, Medicare's loosened the rules, fortunately, but I said, wow, if we could do ambient sensing, I think that would make a lot of sense. So when I first met you, Bob, we were deploying another platform that we were licensing where there were motion sensors and all kinds of different gadgets that needed to be put in the house. But the learning there was that seniors don't want a lot of gadgets in their house. They want you, if they're going to be monitored, it's got to be no microphones and no cameras. And please don't spend a lot of time sticking stuff to my walls, please. So
right.
This is
non-obtrusive.
Non-obtrusive. And fortunately, we've partnered with a great partner who has massive portfolio around what is called Wi-Fi Motion. For those who are listening, Wi-Fi Motion is used in probably 25 million U.S. homes today through Comcast and Verizon as a tool for home security. So if you have Wi-Fi in your home, somebody walks into your home that should not be in your home when you're not there, then you're alerted that your Wi-Fi network has been interrupted. And so our take on the technology is then to use those same types of algorithms to really zone in on the activities of daily living of a senior. Are they getting up in the morning? Did they get up on time? Did they go to bed on time? Did they actually go to bed? Are they wandering when they should be sleeping? Are they in the bathroom frequently? What's that mean? Did they open the fridge door today? Then they're not eating. Were they inactive on the sofa all afternoon? There's so many things we can interpret from just noticing the movement pattern of these seniors invisibly. It's just invisible Wi-Fi. So, yeah, so here we are a year later, Bob, talking about this. And in our last podcast, I I wouldn't say that you were surprised that there was Wi-Fi technology, but you were astonished that this could actually be developed into a robust system that we have today.
So 1 year later,
Yes.
last year, was Lifeguard using Wi-Fi?
Yes, just starting.
Just starting.
Just starting, yeah.
So you got a good year under your belt now?
We do, yes.
And what do you think has changed the most since you've gone to the Wi-Fi?
Well, the marketplace, in our marketplace today, there's a dominant company that's using an acoustic technology. There is implementation friction around that. It's in certain cases, not every place, but certainly opened up a big opportunity for us to provide an alternative. And as I've said to all the clients, like, maybe you want to use both. I mean, this came up in our conversation this morning. Both are complementary. I mean, if you can keep seniors safe, I don't care if you're using what you're using. Let's just do it. I mean, there's 15 million Americans that pay for private home care. Wouldn't it be great if all 15 million had this type of service? And it's just this massive opportunity for all of us. So if all boats are rising in this industry, I'm happy.
100%. I guess my one question is, what is the one misconception people have with regard to Lifeguard and what you guys do?
So there's 3 levels of misconception. There's the misconception at the franchise. Let's say it's a franchise operation or even an independent owner of or a corporate-owned home care agency. So that person is focused in on, will I convert more leads to assessments, and will those assessments turn into business? Will I have more data that will allow me to provide more adequate care or supplement the care that those seniors get? And obviously they're very interested in the churn rate. Like, as one lady wrote to us, she said, she has a franchise operation in Tampa, and I loved what she said. She said, I like it, I get it, I just need to know how to communicate this to the families and incorporate it in my workflow. So it is something new, right? Yeah. So those are maybe not misconceptions that they're having, but it's trepidations that they're having about, okay, is this going to really help my business? Another lady in Austin that we're meeting in a couple of weeks who said, I'm just trying to figure out what pain point you're solving for me. And so I quickly replied, said, maybe you don't have a pain point, but the sons and daughters of the families that you're caring for, they may want more information. They may have a pain point that you could solve for them. So anyway, we'll see where that conversation goes in a couple of weeks, but lovely organization down there. Then you've got the customer service manager. I call them the CSM, or I'm sure in the Cypress organization, there's a level of management that's managing the caregivers and doing the assessments and managing the client relationships. And wow, what I found is these poor people, they're not poor people, but they're seriously worked hard. I mean, they're managing a bunch of very talented caregivers, but the caregiver's sick today, or the caregiver didn't come to work today, or the caregiver maybe is not the appropriate caregiver for that particular. So they're constantly adjusting and modifying their day, if you will. And then Lifeguard. Okay, so Lifeguard's this other thing, but they're really busy already. So there's a little bit of implementation friction there in terms of they want to do it, they understand the benefit of it, but it's just like, I don't really have more time in my day to actually handle this. So that's a thing we're working on. And it gets over to a little bit of what we discussed this morning of providing more information to the families and more focused information. And then you've got the senior in their home, and that's a whole other story about, am I being spied on? What is this? I'm not sure I want my kids to know that all this information. So, yeah, that's the early stages of this industry, and I'm sure we'll work through it. And this is really the wonderful things about meeting you and talking with you, Bob, to figure this out.
It's everybody really has heard the term AI, and certainly people are fearful of Big Brother, right? Ambient monitoring is so different from cameras and listening devices and wearables and help by phone buttons, motion sensors.
Yep.
so we all are learning about AI, but if you could, and you did a good job this morning describing to our viewers and our listeners ambient monitoring using Wi-Fi. I think a lot of people are like, that's voodoo. I don't really understand that.
Right.
But how does that work?
Well, quite simply, the way it works is that think of this room, which has Wi-Fi,
Yep.
as a pool of water. And as you walk through the pool of water, you're making waves. You're making waves. Oh, you made a wave in the bathroom. You made a wave in the kitchen. We know you're there. We know how long you're there. We know how many times you visited the kitchen. And so through data fusion, we can start to understand trends. The data fusion part is there's a sensor on the front door that's not a Wi-Fi sensor. It's simply a motion sensor, if you will, or a vibration sensor. So we know you're home. We know you're there. But why isn't there any activity in this house? Hold on a second. There's absolutely no disruption of the Wi-Fi network. Something's wrong here. Like typically Mrs. Jones is very active at 2 p.m. Now there's absolutely no motion. Why is there no motion? Has she fallen? Is she asleep? Is she, et cetera? So that's really how it works. It's detecting the patterns of knowing what should have happened or should be happening and what should not have happened.
I think that's a great description, and it kind of leads me into the next question. Obviously, I love the fact that we're not telling someone they have to wear a wearable.
Yep.
We don't have all these, sensors that we have to connect. But you talk about these waves, and really, truly, there's AI that's operating in the background. And, what I learned this morning is Lifeguard helps and creates a baseline. We have to have a baseline to work from. I think what I heard is it takes sometimes up to 2 weeks to really establish that baseline, to really discover changes in patterns and disruptions in those patterns to discern that changes are happening. Do I have that right?
Yes, Bob, certainly in terms of the sleep patterns, et cetera, bathroom usage patterns, that does take some time for your mother's house is different from my mother's house. The configuration of the house is different. But in terms of critical inactivity, if we know that your mother's home and there's no activity in the home, then we know that immediately. That turns on immediately in the system. So there's parts that are learning and there's parts that are active from the moment that we set up the system.
You and I have talked about this, the future of home care. And this is where I think your expertise shines. And I learned a lot just at the beginning of this podcast about you. I didn't realize that you were in the fitness business, and you were disrupting the fitness business before really coming into the healthcare and disrupting healthcare. And, I truly believe, and you understand too, that this technology and any technology doesn't replace caregivers. It makes caregivers better. Wouldn't you agree?
Oh, 100%. 100%. And particularly if they engage in it. And I think it makes any organization, that's a great question, Bob. Like if my mom was still alive and living in Fountain Hills, I'd feel so confident that Cypress would be looking after my mother, not just because they have good caregivers, but they've got this supplemental technology that's adding more data to the story. And I think every care agency that I've talked to often says, I have the best caregivers. But what does that actually mean, right? If there's no data to back it up, do you have less hospitalizations? With technology, you can prove that.
Absolutely.
Right? So at the end of the day, we don't want our mothers or fathers going to hospital. So that, for me, that's kind of the gold standard is, what are you actually reducing hospitalizations? And I think for your referral sources, that's also the thing they're most interested in as well.
Yeah, and it's beyond hospitalizations, and this is the way I see it, and this is what gravitated me to you and others that are really looking to disrupt and change the way we deliver care. It's the cost of care. Mm-hmm. The cost of care is up over 50% since the pandemic. Mm-hmm. So consumers just don't have the discretionary dollars anymore, but their loved ones don't want to leave the home. They want to stay independent. Mm-hmm. Because if you put me into assisted living, I'm one step closer to discharging to heaven. I don't want to do that, but I just need a little bit of help. Mm-hmm. where I see the value in Lifeguard and what you guys have created and continue to create and improve is the ability for consumers to have that ability to stay at home, have care, direct care workers come in and be able to help with activities of daily living, but also expand the care beyond that 24/7. So we've got monitoring in the home 24/7. We've got monitoring when the caregivers are too, which we do want to. We want to make sure there's consistency, right? We talk about disruptions,
Right.
and we talk about changes in patterns. You know, we use in the home care agency world, we use electronic visit verification. Mm-hmm. But trust me, everyone's trying to figure out how to beat the system, and some caregivers have. But for us, this would be validation that the caregiver did show up, because Lifeguard would report it because
absolutely. Well, there's motion.
There's motion in the
exactly.
home. So, you know, for me, I think you and I have talked about it, you know, for a couple years now, that we don't have enough caregivers, and we need technology to assist us in delivering care. And I love where you're going with this. I mean, when you started describing, and I used the word voodoo earlier, when you started describing this Wi-Fi mesh, it was just way over my head. And your presentation earlier this morning and the one here on our show really helps me as a provider, but also helps me to convey this to consumers and customers on how Wi-Fi meshing works.
Yeah. And the beauty, one of the nice parts, you know, we often talk about the implementation friction, Bob, but, you know, when you come into a senior's home, you really don't have a lot of time to set something up. Like, we could imagine a system that has radars and different types of motion sensors and infrared sensors, et cetera, but you've got 10 or 15 minutes before the senior starts to say, hey, I really don't want wires running around my house. I don't want all of this surveillance. So the Wi-Fi is very, very, very effective, and it's very efficient. It's easy to set up. Our system takes maybe 15 minutes at max to install. So
I mean, seriously, it's just an adaptation to the plug.
Yeah.
A couple sensors.
That's it.
Router.
Yep.
That's really it. Yep. You've tried to make it as easy as possible. And for those agencies that may be watching us here today, I mean, we don't want a geek squad guy coming in to connect all this.
Yeah.
We want our care coordinators to have the sophistication to be able to do this as easily as possible. Put them in and then move on, and make it somewhat, you know, innocuous and unseen for the consumer to have.
You know, one of the really wonderful parts of our meeting this morning was being explained that if you get an alert from a system, your staff spring to action at 3 a.m. If they hear a fall, they're on the phone.
Yeah.
You know, and isn't that what every home care client wants? Is that complete wraparound service, that emergency after hours, if something's gone wrong, that it's going to be noticed and attended to. I mean, that's what more could a client ask for, really?
Well, and the other thing is that they're not going to be calling me; they're going to be calling your customer
our
service.
Lifeguard Alert Center. Yes, exactly.
And certainly the other thing is that you've got nurses that are monitoring too to see those changes in conditions.
Right.
And if we need to elevate it, we'll elevate it.
Yeah.
If it just needs a caregiver, then we will get a caregiver.
A caregiver
out
there. Yeah.
And not just a caregiver.
Yeah.
A caregiver.
Yeah.
A quality caregiver like
Sure.
from Cypress Home Care.
Right.
You know, it's hard to predict where we're going with this, and it's hard to predict where Lifeguard is going. But here we are, and it's July 2026. You were here a year ago. Mm-hmm. What do you think a year from now is going to look like?
Well, one of the big things that's happened in our world, and again, this gets back to the Medicare's, you know, the CCM RPM 2015, the watershed moment that I talked about. Mm-hmm. I've always felt that, you know, who has the biggest pain? Whose pain are we really trying to solve for? And it's the MA plans, it's Medicare, it's Medicare Advantage. Well, we met the wonderful Amy from Molina today.
Yeah.
So the number one cost driver of any MA plan falls. hospitalizations from falls.
Exactly.
And so now we're in the world of the big, beautiful bill. There's a $50 billion incentive that's now in play for rural health. And those rural health initiatives have to be spent on things that are not currently covered by Medicare or Medicaid. So to Amy's point this morning, Medicare and Medicaid, they do pay for remote patient monitoring, traditional biometric monitoring.
Right.
But they don't cover the ambient monitoring.
And traditional meaning wearables.
Traditional means,
They
exactly.
They have a dependent.
Well,
help by phone. They do supply that for free here in our state.
But traditionally, they're talking about taking blood pressure, and they're talking about taking weight and blood glucose, et cetera.
Mm-hmm.
So now we're being contacted by states who are saying, oh, we've got a rural population. We'd like to keep them in their homes safe and sound. What can Lifeguard do for us? So I think when we talk again in a year's time, we will probably have contracted with, I'm hoping, a dozen states around that initiative, and I'm hoping that will grow from there. So there's our first foray into that marketplace.
And I want to share this with our listeners. You've already contracted with one right now, so it's not like this is foreign to you.
No.
So now you take that momentum, you take it and repurpose it for other states and
that's it.
State contracts.
Exactly.
I know you got a couple out there already.
Yeah, that are in the works and look very promising. So I think that's a big part of the story. Incredibly, the chap who introduced me to Cardinal Health is now a consultant. He ran health systems. Is retired now to South Florida, where I live, and we've reconnected. And he's all things health economics. Like, he understands intimately the economics of a health system. He understands MA plans. He understands ACOs. And so we've got a number of pilots that he's introducing us to in all three of those categories. And all three have pain around readmissions and keeping seniors at home. Keeping seniors at home keeps their costs down. In the case of an ACO, it increases the benefit to the ACO members. I think we're just on the cusp of something very large here. But I think also, Bob, that without losing our focus on home care, that with your help, we're going to be filling in some gaps in what the Wi-Fi motion can do and the type of reporting it can generate and its effectiveness in helping your case managers and your care managers and your caregivers provide even a deeper level of care to those seniors. So the two-way speaker that we mentioned today, the type of reporting, the integration with Access Care, your EMR, these are all
drones.
The drone is
that's my idea, just so you know. Yeah. I've been on Nat for about 3 years.
We are talking to a company in China about the drone. They've got some technical challenges, and as you might have seen, Ring is also talking about an indoor drone for the last 4 or 5 years. But I think it's the coolest thing, honestly. Like, to validate what's going on in the home, just there it is. It's literally the size of that iPhone.
Oh yeah,
it's it.
And it flies like a Roomba. So it won't hit walls.
No, exactly. But it runs into glass walls, and there's some technical issues that need to be solved. Yeah.
See, I didn't know that.
Yeah. Okay, yeah.
We can work through those.
Yeah. Well, it's like Waymo. I see all the Waymos here in Phoenix. What do you call it? Waymo?
Waymo.
Okay.
Waymo. It's Google.
They still have some. I followed one today that changed lanes without signaling, so they're still not completely bulletproof, but they'll get there.
Yeah, they have now paused their highway driving. They were on the highway before, and it was seamless for me. I took them to the airport. Wow. Great experience.
Okay.
I mean, you talk about, it remembered my device, and when I got in the car, it played my Spotify.
Yeah.
I was like, wow, this tune sounds really cool. And then I looked and saw that it was playing my Spotify.
I love it.
It was just fascinating.
Yeah.
We've come so far, and we still have so much further to go, especially in healthcare. And,
Seems like so, not to interrupt, but it seems like Phoenix is a hotbed. Like, I saw my first DoorDash robot today.
Yeah, they're pretty cool.
Yes, very cool. So I wonder what's inside that thing. Like, is it like a hot chicken sandwich that's being delivered someplace? Probably.
It probably was still hot too when we got there.
Yeah,
because it's really hot out.
Yep.
So, Along those lines, in terms of the future and where we're going, if CMS called you tomorrow, what's the one thing you would tell them about aging at home?
Oh, boy, that is a wonderful question. What would I say? Well, I tell them that the preponderance of seniors want to stay in their home. And isn't it more cost effective for everybody to keep them safe and sound in their home? Doesn't that just make sense?
It totally makes sense.
And, to Amy's point this morning, do we really need to do a pilot to prove that makes sense? But I guess in the world of Medicare and CMS, you do need data, even if it just makes sense. So eager to engage with you and Amy on perhaps getting that pilot together. Yeah.
No, I'm eager as well. We talked about 1 year out, and I know you don't have a crystal ball, but I know that this, and you and I are really close to the same age, and I look at you as a serial entrepreneur.
Yeah.
You've been very successful, and you've had some misses. We all do. You swing and a miss, but
yeah,
you've had some that
self-inflicted, Bob.
Yeah.
Self-inflicted. As I look back, I see, there were forks in the road that I just should have thought twice before making the switch. But yeah.
You know the old saying, right?
What's that?
Experience is what you get when you don't get what you want.
Oh, there you go.
And you got a lot of experience, and we try not to make the same mistake twice.
Yeah.
So
it's easy. It's interesting though, as entrepreneur, and we'll get on to the future question, but I think most entrepreneurs are impetuous. They're very spontaneous people. They bite. And once they've bit, they go hard, and they get their hand in and their arm in, and maybe with more thought and planning, there might be a better outcome. But I swear to God, every entrepreneur that I've met, and then the second part of that whole story is, and I've met some great guys who, my best friend's the founder of Crocs shoes. There are probably 5 or 6 serendipitous, you can't believe this, things that happened to him along the way that turned Crocs into Crocs. And when you read Shoe Dog, the Nike found Phil Knight's book, there's 20 things that happened to him. You say Nike, how hard could that be, right? But there's a lot of luck.
I remember when they broke in.
Yeah.
Everyone had the Nikes. They were light blue, white canvas shoes.
Yeah, there you go. Yes, exactly.
Back in the 70s.
With the waffle sole and the whole thing. Yeah. There's a great part in that book where, and I don't know if this will make this into the podcast or into what we're doing today, but there's a great part in the book where he's being hounded by this guy that wants to meet him, and this engineer guy wants to meet Phil Knight and keeps hassling Phil Knight's secretary, and finally Phil says, okay, give him 15 minutes. The guy comes in, and he's got some bubble wrap, and he's got the bubble wrap around his shoes. He said, Phil, this is going to be the future. It was called Nike Air, and that's what became. So Phil put on the shoes and ran around the parking lot, and that became Nike Air. But if he hadn't taken the meeting with this guy,
right?
I don't know, maybe Adidas would have Adidas Air, So anyway,
right.
Just stuff like that. But in terms of the future, we're partnering with a company called Cognitive Systems. Cognitive Systems is a group of about 60 PhDs, engineers in everything radio frequency. They're all ex-BlackBerry guys. And the founder, co-founder of the business is the founder of BlackBerry. And he is the largest investor. Actually, the two, if you've watched the BlackBerry movie, there's a guy called Doug Frang and another guy called Michael Lazaridis. They're the science guys. They've really gotten this thing off the ground. They've got well over $100 million invested in the Wi-Fi tech. Initially in the home security space, as I mentioned, with the 20-odd million homes, but now they're really doubling down on the caregiving aspect of it. So in a year's time, through Wi-Fi motion, we'll be able to measure the gait of the senior. So as we know, diminished gait is a very strong indicator of other issues,
right.
Cognitive issues. We'll be able to measure respiration. So if Mrs. Jones has fallen in the home, then, that's another validation that we'll be able to pick up. And of course, there's other health concerns that revolve around respiration. So the fidelity of Wi-Fi motion will significantly increase, and I don't know if it's exponentially increased, but there are new 5G chips that are coming out, and even Apple now in the new iPhones will have Wi-Fi motion. In the Wi-Fi chip will enable Wi-Fi motion in the iPhone. So there'll just be all kinds of new applications, and as I mentioned this morning, I had to do the wash and drying in my house. And I was coming off the trip. There's some clothes I needed cleaned up. And I said, wow, our new washer dryer has Wi-Fi. So if you can think of all the chipsets in your home, everything, your fridge will have Wi-Fi, your stove will have Wi-Fi, your microwave will have Wi-Fi. There's just endless amounts where these Wi-Fi chips, and Cognitive owns the patent portfolio around this, so that our plugs will now start talking to all these different chips in the home. So instead of just 4 points of communication, there'll be multiple points of communication. And to your point about the large homes, this will just expand our capability to do larger homes, et cetera. So yeah, exciting stuff ahead of us.
Yeah, and I think Megan would use the word technology agnostic. So you guys can plug and play just about anything in.
Yeah. So we think of our system remember the AWACS? Remember that big jet that would fly over the battlefield that had the thing on top?
The big satellite dish on top.
And there's like 50 guys inside monitoring, the battlefield. But they're agnostic, right? I mean, they were agnostic into terms of what signals they would receive. And so we see the Lifeguard Lookout system, which is our EMR, as being agnostic. So if somebody really wanted a radar device in the home, okay, no problem. We'll plug the radar in. We're integrated into 2 or 3 radar companies currently. We have radar deployed, but have found that it's still very early in its days of effectiveness. We're working with a French company that's got an amazing, astonishing AI vision technology. There may be homes that aren't allergic to actually having a camera. And there may be institutions that want that type of thing, and it adds so much more context. So not only did your mother get up in the morning, but the system will let you know that she read the newspaper and that the caregiver came at 9:15 and cooked the breakfast, et cetera, et cetera. So you're just going to see even more context coming from the data.
I mean, the fact that we have the ability today, and companies are out there right now where they can detect just from someone's voice, stress, dementia,
sure,
and possible Alzheimer's based on their voice. And then we also have companies that are using facial recognition, and especially for those that are suffering from dementia and Alzheimer's who can't express whether they're in pain or not. You can do that with these facial recognitions to tell and establish if someone is in pain. So the technology is moving fast. We are, 3 months is like 10 years in terms of advancement in technology. It's fascinating what we're seeing, and I'm excited to see what you're going to do. And I love the fact that you are technology agnostic and you can do a lot of plugins. Right. And whether it be audio, whether it be video, whatever it is, you can tap into it. You've built that mesh network that can do
it's
that.
The core, yeah.
And the fact that everything today has Wi-Fi. I mean, our refrigerator has Wi-Fi. I don't know how it works. I think our oven has it too. We just
there you go.
An oven.
Yep.
But
you need the app to cook your dinner.
Exactly.
Yeah.
And I could preheat the oven before getting home and do a lot of things that would have set me back if I couldn't get home.
Bob, I think that's also a big part of the story. So the app, we have an app, and I guess the learning that we hope to have with your organization is how will the consumer interact with that app? How will it be useful to the son or daughter? Will it be useful to the caregiver? Will it be useful to the case manager? And so I think back to the Starbucks story of when they launched their app, and it pretty much cratered their business because all of a sudden people said, well, I'm going to order my coffee, and when I get to the Starbucks, I want my coffee ready, but it wasn't ready.
Right.
They thought it would be ready. So, it's going to be interesting to understand what the expectation is of an app in caregiving that is providing ambient information, is providing insight into what's going on in the home. Will your case managers be inundated with phone calls from the family? I don't know, but it's going to be very interesting to see how that works into your workflow.
And you and I have had this conversation. I mean, look, AI is revolutionizing everything. It's giving us data, but we have to do the data analytics. We have to study the data. We have to be able to discern changes and patterns and be able to mitigate an event from happening. So there's that data analytics piece that is so important that we're going to capture. And your Wi-Fi mesh system is going to capture a lot of data.
Yeah, exactly. You mentioned in one of your LinkedIn posts recently that you'd been at a conference where it was data, right?
Yeah.
Yeah.
That's what it should
so
be.
So let's use the data to distinguish your organization from every other organizations that's not data friendly, right?
But for me, being an operator now, personally running my family's business 23 years, but us being in business 32, it's amazing how we are doing business today and how we existed before without this data. I mean, just not that long ago, the EMR I was using wasn't real time. At 12 o'clock every night, it would refresh and it would give me the data from the day before.
Okay.
So it was already stale. And I need data that is very current to be able to act on it, especially when you're talking about people's lives.
Well, as you said this morning, I mean, you got to call it. You heard an audio at 3 a.m. There was an alert that somebody fell. You didn't have that data before.
No.
So typically, I'm just guessing, but I'm assuming that 20 years ago, in the absence of that, that senior would have sat there for 4 or 5 hours till
And
the
the caregiver would
caregiver
have walked in and they could have been deceased or
or go to the hospital, and then they're no longer a client, right? So yeah.
You know, it's very obvious, Nat, that you've spent your entire career helping people stay healthier.
Oh, that's kind.
You have, whether it be through
Fitness machines.
fitness machines,
Yeah.
and now with Lifeguard keeping them out of the hospital.
Yeah.
When people remember your work years from now, what do you hope that they would say?
Wow, that's a deep question.
I got more.
Okay.
But let's
Well, I
start
mean,
on
I
this
don't
one.
wanna, all of these things have been innovative. You know, the direct primary care, the electronic medical record with the telemedicine components integrated, the fitness machines with the screens and the interactivity. The one I'm really proud of, but didn't really pursue. A lot of people say that. Well, some people have noted that I invented the world's first mobile health app, and the world's first mobile health app apparently is a thing called My Food Phone. And
It's called
My Food Phone.
Wow.
So think back to 2002, 2003. I was on a bit of a diet thing, and I read someplace that the New York Times has never had a bestseller list that didn't have a diet book. So, wow, okay, here's an opportunity. And I was aware that Sprint was going to launch North America's first camera phone. It just had one camera. Remember the flip phone?
Oh, yeah.
Okay, and there was a Sprint, it was called Sprint Camera, whatever. And serendipitously, the manager, when I contacted Sprint to get more information, he was from my hometown. And so we kind of built a relationship. So I said, look, I got this idea that consumers would want to take pictures of their food, and I'm going to allow them to take pictures of their food and send it to a dietitian. And the dietitian, she's going to analyze what they're eating and tell them to make better choices, right? My Food Phone. And so we launched My Food Phone on Sprint. We quickly got about 6,000 or 7,000 subscribers. But these are in the day, this is long before the iPhone.
Yeah.
You had this thing called the walled garden. Sprint had to approve your app. There was a whole testing thing that it was very, very rigorous to get an app on. And consumers weren't really interested in, they didn't know how to get the app to their phone, so you had to push it up to them. Anyway, it's a long story short. But in many ways, you know, this individual, when we launched, he said, Nat, we're all going to be broadcasters with this technology. And if I had just thought that through to where we are today with YouTube and Instagram, my trajectory as entrepreneur would have be much different, right? And we did not pursue Food Phone, or we didn't pursue any patents on it because I thought, well, this is just a novelty. But when you see the Instagram feeds now of people,
Everyone takes pictures of
their food. Exactly.
Yeah.
You see it all the time in restaurants, etc. So yeah, I hope maybe they'll remember me for Food Phone. I don't know, but
well, yeah. I mean, look, you've always been, thinking forward thinking and thinking about how you can solve.
Yep.
One on the fitness side, one on the health side, and keeping people safe at home.
Yeah, but Bob, honestly, you can't do that in the crucible is our great entrepreneurs like yourself, like at Cypress, who embrace the change, lean into the change, accept that there's going to be some bumps, and I think you've maybe had a couple of bumps along the way as you've been using.
I've shared here with our audience.
Yeah,
most recently a ruptured disc.
Yeah. So
we all experienced that.
There you go, and So I'm just totally grateful to be in your orbit, honestly, and in the orbit of your professionals in your organization that I met this morning. And I know that in that crucible, our ability to prototype quickly and adapt technology quickly, test technology quickly, and your team's ability to articulate the need. Okay, I need instantaneous. I don't need a report in a week's time. That's too late. I need a report now, which is, I need material to help push this technology into the home. Okay, let's work on that. There's 5 or 6 takeaways from this morning's meetings that a young little company like ours can just get their claws into and move quickly to fix and make the product better, make the service better, and grow from there. The whole Moore book on crossing the chasm, the whole idea of the early adopter and then the chasm and then the pragmatic market, we're still here. We're still in this very early adopter space. And there's a whole world of pragmatism out there that's looking at us and probably not hoping that we fail, but hoping that we work out all the bugs, perfect the whole thing, and then bring it into the mainstream market. But I don't think the mainstream market's more than a couple years away, 2 or 3 years.
I kind of agree. I mean, look, if you go back to the early 90s and late 80s, it's like the internet, when we first discovered the internet.
Yeah.
I keep saying that we're, the same age, but we're not. I mean, you're much more well preserved than I am.
Oh, come on.
You do a great job of taking care of yourself, and I ask you this very thoughtful question about what would they say, and certainly I think about, especially with my recent health event that happened. I've come to terms and realized that I'm not immortal. I'm not going to be here forever. I want to make a lasting impact. And, I know you're the same type. You want to be able to be remembered, not for just being, a great loving husband or, a great father or a great son. You're looking to disrupt and change the way care is being delivered and keeping people at home.
Yeah. Well, thank you, Bob. And I think your footprint on the industry is going to be much larger than mine. I mean, you're working in so many different dimensions. I'm just on the tech side, but you're working at the governmental level. You're working in the,
trying.
Yes, I mean, you're making the elephant dance, honestly.
Thank you.
And certainly inspiring this morning to meet the lady from Thrive 365, and I just start thinking, wow, I've got to import some of this to Canada. We need this, in any state, any province, any country.
Yeah, whether it be adult daycare, whether it be kinship services,
the technology, whatever. Yeah, it's just and have that resource that can help seniors and their families navigate. So, here we are, a year later. It's been a journey. It's hard to get these little companies off the ground. There's a lot of lift, and we saw the Artemis launch earlier this year, and I just see that rocket shake, and I said, this is really what entrepreneurship is, that push, that just to get off, the 30 feet off the tower, then 300 feet. It's just a lot of energy goes into that, and I think we've both been fortunate to find the right teams. And
well, it's interesting for us too to see the fact that they can take those rockets and have them land back on the launching pad in between two chopsticks.
Yeah.
That just
blows
to me,
my mind too.
It blows my mind that we're able to do that.
Yeah.
So this is part of the interview, the podcast that I really enjoy, because I get to have you share with our listeners and our viewers the human side of you. And I did not prep you for these, but I'm going to hit you with a bunch of rapid fire questions.
Rapid fire? Oh boy.
Okay. So we're going to rapid fire some questions. Require 1-word answers, but if you want to expand on it, you can.
Okay.
I'll start with easy ones, and then we'll go from there.
Okay.
Coffee or tea?
No caffeine. Never tried caffeine. I had a kombucha this morning, but I've never tried coffee. I've never tasted coffee.
Wow.
Yeah, my mother was a big coffee drinker, and I just said, yeah.
I'm not a coffee drinker, but I've tasted it.
Yeah.
Not for me.
Hot beverages, not my
But I like tea, so.
Okay. Yep.
And it's not about me, it's about you. So mountains or beach?
Oh, mountains.
First thing you do every morning?
I know this sounds maybe trite. My wife says I wake up as the happiest person in the world. But honestly, Bob, I wake up with a big smile on my face. I'm just, eager to get the day started. I'm an early riser.
I love it. How early do you get up?
Oh, early. Like, I'm talking 5,
Okay.
5:30.
I'm with you.
Okay.
I'm usually up by
That
5.
ballpark, yeah. I find my best work is early in the day. Yeah.
Apple or Android?
Oh, Apple. 100% Apple.
One technology you can't live without.
iPhone.
One technology that you think is overrated.
Social media.
I like that. Favorite innovation in healthcare over the last decade?
Oh, I would say the latest that I've seen is this thing called the Clearly. As you know, my cardiologist is here in
Yep.
Phoenix. And my father passed from heart issues. I've had so many friends, families be impacted by premature heart disease, etc.
We just lost a senator.
That's right. Yeah,
Yeah.
my word. Yes, that's so true. And so you talk about AI, and if you think of your CT scan of your heart, so here's your heart. So doctors before here's the arteries running around your heart, and they could kind of do this 3D thing with your heart. But now they have a new technology, an AI technology, which takes the CT scan, the digital image, spreads out your arteries like a little worm on a piece of paper, and they can pinpoint exactly the composition of the plaque. So is it calcified? That's not bad. If you've got calcified plaque, it's stable. It's not going anywhere.
That's where I'm at.
Okay, good.
You don't want it loose.
Yeah, exactly. But if you got the loose stuff, that's the stuff that can create the problems. And then there's this other thing called ischemia. So that's the part of your artery that's not getting enough oxygen, and it can create issues. So I've had my Clearly now for the last, I just got it, I just was at Dr. Firemilk today. I'm happy to report I'm making progress on reducing my heart disease. But I know now, like I have the data.
Knowledge is power.
Knowledge is power. I know where I'm at, and fortunately, I don't have anything that's lurking inside me that could kill me right now. But if everybody had that, like if I had a meeting, as you say, had a meeting with CMS, give everybody a Clearly. Come on, give them a CT scan. What does that cost? Right. And have the analysis done. We'd save so many lives. That would save lives.
It's still the number one cause of death.
Sure.
Heart.
Yeah. Yeah.
We need to do better. We need to do better.
Exactly.
If you weren't building a healthcare technology company, what would you be doing?
I'd be working on the homeless problem we suffer. As you know, I spend my summers in Canada. Recently in Ottawa, our nation's capital, has been decimated.
Homelessness.
It's just so sad. And Canada's a wealthy country. We have resources. We have an incredible social net that doesn't exist in other countries. And for the life of me, I can't understand why this is a problem now. And recently, the research I've done is focuses on the housing crisis. A lot of these people have lost their homes or their affordable places where they could live, and this is driving them to be in these terrible predicaments. I'd be working on that. Like that, I see that as like actually the end of my career. Is I'm going, once Lifeguard's up and running and hopefully successful, then I'm gonna spend some time digging into that. It's not something I can solve by myself.
No,
but I'm gonna work on that.
That's
in a hard way.
That's an admirable thing to be working on. Favorite city you've ever visited?
Well, I'm very, very prejudiced to Quebec City. So we're on an audience, a podcast audience. I invite
Quebec
anybody
City it is.
to come and visit. I'm hosting with Griswold later this year a couple of seminars in Quebec on their shared care program. But regardless of that, it's beautiful. It's clean. It's foreign. It looks just like France. It's French. It's Canadian dollars. So again, it's relatively economical for anybody to come and visit. But I would say that's my favorite city. European city, Copenhagen.
Okay.
Fusion, a little Latin, Nordic fusion.
Okay.
A lot of bicycles. Worthwhile visiting. Absolutely.
I have to get to both of those places.
Yeah,
they sound amazing.
Well, Quebec City is your next visit for sure.
Well, know what? I get an invite. I might be taking you up.
You're invited. Yeah.
Work out in the morning or evening?
Morning. But that depends. I'm on a track now with a trainer who can only see me in the afternoon, so I kind of do the cardio in the morning, and then I'll I'll sneak out and do the weights in the afternoon.
There you go.
Yeah.
Book you recommend?
Oh, London Falling.
London Falling.
London Falling. Just read it. New York Times bestseller. New York Times is one of the best novels, or best that's ever been written. A page turner. Little Russian mafia.
Ooh.
Little London. Oh boy, and it's a true story. It's a true story. Not a happy story, but a true story. Definitely.
Okay. One entrepreneur that inspires you.
Oh, there's so many. There's so many.
Anyone come to mind?
Well, I mean, look, we can all talk about the favorites, I mean, Musk and Gates, etc. I would say Tim Cook is probably, he's, I know he didn't start Apple.
No.
Okay. But you have to say this gentleman, he's got entrepreneurial skills that are just
100%.
off the chart.
Well, especially to follow after Jobs.
Yeah.
That's not an easy task to do.
No. And now, of course, he's opened up the litigation with OpenAI, and that's kind of his defensive push to keep them in place for a while, because OpenAI will disrupt the iPhone world will change with AI. So
it already has, and it continues to change. What's the best business advice you ever received?
I've had a number. And I should have do this more. My wife would say I had an industrial psychologist that I worked with for a long time, and he really helped me. I had a bankruptcy. One of the first businesses went up. Again, should have followed my wife's advice, but didn't. Kept two companies separate, so the two companies were together. One product worked, the other didn't, and it made it just basically cratered both things.
It's a humbling experience.
Oh yes, and waiting for the birth of my first child, and it was a mess, and so that was a rough start actually, but because you sort of started, you're flying high, and then all of a sudden you crash, and he had several pieces of advice, but I guess the major one was you really think twice and cut once, measure twice, cut once, like a good carpenter. Sit in a room and just think, as opposed to being so impetuous and pushing forward. I would say that's...
You answered two questions with that one, so
yeah.
Check. So if you could have dinner with an innovator, living or deceased, who would that be?
Oh, Jobs, for sure. I'd love to... I'm not sure how the conversation would go, but yeah, absolutely. Leonardo da Vinci, perhaps, if we could go back in time.
There you go.
Yeah.
What's the one thing people don't know about Nat Findlay?
I don't think I've managed my brand that well, Bob, sincerely. Like, this is a very heartfelt comment. I really like to build relationships as opposed to transactions. I think that a lot of businesses are built just on the transaction as opposed to the relationship, but my most fruitful businesses have been built around a friendship that has led to a business as opposed to the business that led to a friendship. And sometimes I've not managed those friendships as closely as I should have. And I regret that, particularly in the case of my first bankruptcy. There were a couple of guys I was working with, and I wish I could just go back and patch all that up, because they were really good souls. They were good people.
It's never too late.
Well, that's right. I should.
Never too late. They might be watching this podcast.
Well, yeah, I hope they do someday. That would be good. Yeah.
What's one word that describes great leadership?
Respect. Respect.
Perfect.
Yeah. Respect. Absolutely. Yeah. I think I try not to be trite with my respect, but I try to shower my team with respect, and I think it's fuel for them. I think it's so many. You don't get a lot of applause in business. It's fast paced.
Yeah,
it's the next meeting. Being able to tell Megan and Chelsea today they did a great job. They connected with the audience.
But I don't think, being an entrepreneur and being a CEO and managing partner, I think most employees don't really realize how hard that is. Mm-hmm. And, if they could ever wear our shoes one day, they could understand how difficult it is. So I get the need for respect.
Particularly in the world of text and email. So,
Yeah.
Driving here.
It's
Excuse me. There's
it's a monologue. It's not a dialogue.
Yeah. It's this. What about this? What about that? What about this? Etc. So, I'm fortunate, Bob. As I look back on my career, I mean, my head of development, the two heads of my product development team, the software development team, is 25 years now. We work together.
Wow.
Stephen, 23
That's
years.
crazy.
23 years. And it goes on like that. I mean, I've got a team that I would say the average is, well over 10 or 15 years.
So I'll ask you one more question.
Okay.
And that is, technology can tell us that someone is declining. Wisdom tells us what to do next. How do you make sure Lifeguard never loses that human element?
I think that has to be founder driven, because I think that in the financial side of business today, there's just this common thing that AI is going to replace AI is going to replace common sense.
It is.
And I don't want that to be my legacy at Lifeguard, that it's just a bunch of bots that are looking at signals coming in from it gets back to the comment this morning about in our Wellbox business, where I would listen to the phone calls, and this is Mrs. Jones talking to Nurse Smith, and there's a human thing going. It's not an AI engine talking to the senior to see if they're happy. It's two empathetic souls connecting. That's Lifeguard. That's will always be Lifeguard in my mind.
I said this to you before. I love the name Lifeguard because we're guarding a lot of lives. Appreciate you taking the rapid fire questions. It gives our listeners and our viewers an opportunity to learn a little bit more about you. I've learned a lot about you in this interview here today. Is there a question I haven't asked, or is there a lasting thought you would like to leave our listeners and our viewers here today?
Bob, thank you for opening up the floor there. I guess the current challenge with Lifeguard is the adoption rate. It's making it simple for seniors to say yes. Like family members, sons and daughters, they get it in a heartbeat. They're tech friendly. How can we make this super friendly for all of your constituents? Like, why can't everybody have Lifeguard? So we talked a bit about reverse mortgages this morning.
Yeah, we did.
And, seniors don't want a mortgage. What's a reverse mortgage? That sounds even worse, right?
It does.
Yeah. So when you go to a senior's home and you start talking about monitoring and detection, and these are just, their backs go up immediately. Like, why? And it's just going to be a much simpler way to do that. And this gets on to the point of us working together with some really smart, creative people here in Phoenix that you're going to identify, but Lifeguard's going to engage, and we're gonna crack the code, Bob, together. We're gonna crack that code.
And when you think of the name Lifeguard, I mean, listen, you think of Lifeguard when we go into a pool or in the ocean. It's not that we can't swim. We can swim.
Yep.
We just need somebody there as an overlay protector, right? That's what you're doing with Lifeguard in the home. Yep. It's kind of like an
I love that.
It's somebody sitting up on the stand.
Oversight.
Sitting up at the stand, they're literally almost 10 feet higher, and they're looking down just to make sure you're okay. Yeah. I mean, that's the metaphor, and that's the vision that I have for you and doing Lifeguard.
I love it.
Well, Nat Findlay, it's great to have you back.
Thank you, Bob.
We're going to have you back again next July to see if some of those predictions do come to light, but also to come back to Phoenix and Scottsdale to see how we are doing with Lifeguard, because we're getting ready to kick things off. Yeah. Excited about what.
Yeah. Just a quickie to finish up with. I don't know if this will make it into. See, we've gone over time.
Well, Scott will make sure it makes it.
Okay, but it's interesting. A few years ago, I was invited to be part of this MIT 10-week entrepreneur thing. 10 weeks, 10 different sessions on entrepreneurship, and there were 10 of us in the room, 10 entrepreneurs, and they all had some businesses and started businesses. And the lead guy comes in, the lead professor comes in, he asks, what does it take to have a business? And, you need financing, you need technology, you need...
A lawyer.
Everybody had a different answer. And this one lady said, you need a customer. And he said, that's right, you need a customer. If you have a customer, you have a business. So, Bob, again, I'm very, very fortunate that we're going to work together and build this relationship around solving the next frontier of ambient monitoring, keeping seniors safe at home. So kudos to you, and thank you for your passion and your energy around this.
Thank you. And I look at it as that, but I also look at it even bigger. I mean, I think this is the greatest problem solve of not just our generation, but humanity. And that is how we're going to care for all these old people.
Oh, boy.
And we don't have enough assisted living. We don't have enough independent living communities. We don't have enough skilled nursing facilities. Home has to be the center of care. And the only way we can do home as the center of care by bolting on innovations and technology, wraparound services like Lifeguard.
Yep.
So I'm pleased to have you not only as my friend, but now also as a business partner.
Right.
And really changing the lives of the people that we care for.
Thank you so much.
Thank you, Nat Findlay.
Okay, thank you, sir.
Make it a great day. We will be back next week. Thank you for being on Health Futures.
Thanks for listening to Health Futures, Taking Stock in You. I'm Bob Roth, reminding you that living well isn't just about years, it's about the quality of life and connections. Follow and share the show, and join us next time for more on how to live a longer, healthier, and happier life.